I rise to speak to the Drugs, Poisons and Controlled Substances Amendment authorising Pharmacists Bill 2023. What this bill does is it amends the Drugs, Poisons and Controlled Substances Act 1981 to introduce new regulation powers to enable pharmacists to supply, dispense, administer, use or sell Schedule 4 poisons without a prescription in certain circumstances.
After much deliberation, the Greens will be supporting this bill because fundamentally we believe in improving access to healthcare. As a health practitioner, I know all too well the consequences of delayed access to primary care, and in particular, this pilot has potential to improve access for women, for certain issues, and for people in areas with limited access to primary care, like rural and regional communities.
One of the big bonuses of this, which is very obvious, but really meaningful to people, is the fact that it saves people time and it saves people money. Not only that, it takes pressure off our health services.
Our GPs are frequently under the pump, and I'm sure anybody living in rural and regional Victoria will understand that when you ring up to make an appointment with, if I say your doctor, if you can have your doctor, can be a month's wait at least. And for various conditions, acute conditions, these can be, certainly not potentially the contraceptive pill, but urinary tract infections and minor skin disorders, they are acute conditions. They need to be seen within days to avoid that walk into the emergency department.
Well, I've always disliked the requirement to go back to a doctor to get prescription on something that you've had prescribed to you for a number of years, and that no doubt you will continue to have prescribed to you over a number of years.
Prescribing pharmacists are not a new concept by any means. They have been a common fixture in the health system in New Zealand, the United Kingdom and Canada for over a decade and have proven to be very effective in decreasing the strain on their hospitals, clinics and other places of healthcare delivery.
Something does need to be done, but not in doing so we cannot put patient safety at risk. I don't believe this is the answer. I've received a range of community feedback. This has sometimes been called a dangerous pharmacy experiment. So I think if we're getting that feedback, then we have to ask ourselves, well, what can we do to make it safe?
The urinary tract infection community pharmacy service pilot was completed in Queensland in 2022. An evaluation of that program by Professor Lisa Nelson at the Queensland University of Technology concluded that the program delivered safe and appropriate care that aligns to clinical protocols, and that pharmacists have the appropriate skills, competencies and training to manage the treatment of uncomplicated UTIs in the community pharmacy setting.
Once it is concluded, the evaluation's findings will shape future policy settings regarding the role of pharmacists and pharmacies in Victoria. The sooner we start, the sooner we can look towards how we can improve all Victorians' access to safe primary health care.
In respect of oral contraceptives, these are one of the most commonly used contraceptives in Australia. Timely and accessible access to contraception is imperative for greater autonomy, improved health, and it decreases stigma.
Consultation on the bill has been limited because this bill creates a 12-month pilot within which consultation will occur. Further design will be informed by comprehensive stakeholder participation. So this bill automatically creates a dynamic real-time trial for engagement over a 12-month period, fulfilling our 2022 election commitment to back pharmacists to boost our health system.